this was the final result, actually a little bit before the gingiva had a time to mature. This is also lithium disilicate with a cutback so that it is veneered with feldspathic porcelain. And you can see the nuances that can be brought out by a good technician. Can we use other materials? Are there stronger materials that we can use in the anterior? Sure. Zirconia could be one of the materials, but one of the drawbacks of zirconia, is a very strong material, is that it is not translucent enough. So the manufacturers have answered this with the new so-called anterior or translucent zirconia. This is a unique zirconia. This is called MT multi. This material actually incorporates two different types, translucencies of zirconia, and also two different strengths of zirconia. The incisal edge is a 5Y zirconia, so it is about 650 with this manufacturer. It's about 650 megapascals, while the rest of the tooth, the body, 2/3 or so, is 4Y zirconia that pushes the flexural strength up to about 850. Now, two questions come up in this. One is this material strong enough that we can conventionally cement it? And the other is, even if it is, should we conventionally cement it? What about the aesthetics? And we'll have some answers to that in a little bit during the lecture. Here's another material. This is also zirconium. This is also a marriage of two different strength of material. This happens to be 5Y, the very 650 type material. In terms of flexural strength, but the body in this case, because it's being used for the posterior, is 3Y zirconium. So that is the regular zirconia and the strongest zirconia that we have at the present, and that has about 1,100, 1,200 megapascals of flexural strength. What about the cementation material like that? Should it be conventionally cemented because of the strong material, and what about the aesthetics? Well, because it's in the posterior, probably conventional cementation of this would be adequate. However, use of an adhesive cement or an easy cement, in other words, an adhesive cement that is not complicated in its use, might be a better choice because of the aesthetics, even though it is in the posterior of the mouth, and we know that there are some patients who are quite demanding. Another thing to consider is not only the material itself, in other words, the type of material that we're using, but the thickness of that material. Here's a study done to determine the translucency of materials at different thicknesses. You see here the flexural strength of some of these materials. So what we have is one lithium disilicate, which is about 400 megapascals, compared to a slew of zirconia that is somewhere close to about 1,000 megapascals. Now, if we looked at each of these materials according to the manufacturer's recommendations, we see that Emax, or in this case, or lithium disilicate, which is recommended to be used in the posterior at 1 millimeter, has the same translucency parameter as a typical zirconia, which is recommended to be used at 0.5 millimeter. So you see that these are actually equal. And if you look at the other materials in this group, you will see that they are also 0.5 millimeter is the recommended, or at least the minimum recommendation for their thickness. They are actually more translucent than the so-called very translucent lithium disilicate. So this is another reason why you might want to think, well, even though you can conventionally cement the zirconia, in certain areas you might want to use an adhesive cement because of the aesthetics. Here's a case in point. This was the same as I showed you before. This is empty multi. This is a material that's a more translucent zirconia. In fact, two types of zirconia. It's rather minimally prepped, although you do need adequate preparation for this. And this was a compromise. We could have used lithium disilicate in this case to make it a little bit more more aesthetic. But as you'll see in a minute, why we chose this rather structurally stronger material. But even though it's structurally stronger than lithium disilicate, here the preps, and here's what it looks like in the mouth, and of course not quite as let's say quite as aesthetic as lithium disilicate. This is a monolithic material. Don't forget, there's no porcelain that is veneered on this, and the reason was that you can see here is that the patient has really destroyed their teeth, and